Clinical details of major symptoms. Textbook of jmmt compiled by Saburo Sasada, Ph.D. of Acupuncture, SNESVI, Tsukuba University, Japan. Sponsored by JICA, August 2013. Contents: Part-time musculoskeletal disease Lesson 1. Low back pain and sciatica Lesson 2. Knee pain Lesson 3. Ankle pain Lesson 4. Shoulder joint pain Lesson 5. Neck shoulder arm syndrome Lesson 6. Elbow pain Lesson 7. The wrist and finger pain Lesson 8. Spinal alignment/disalignment 1. Lesson 9. Spinal alignment/disalignment 2. Lesson 10. LPP and CPP of the joint Lesson 11. Osteoarthritis, OA. Part 2. Internal disease Lesson 12. Autonomic nervous system, and jmmt Lesson 13. Nature, rhythm and autonomic nervous system Lesson 14. Headache and fatigue of the eye Lesson 15. Digestive problems Lesson 16. Woman's symptoms Lesson 17. Lifestyle diseases Lesson 18. Obesity Lesson 19. Hypertension, high blood pressure Lesson 20. Diabetes mellitus Lesson 21. Cardiovascular disease, CVD, Lesson 22. Respiratory disease. Part 3. Mechanism and analysis of jmmt Lesson 23. Anatomy related with facial massage Lesson 24. Mechanism of facial release Lesson 25. Mechanism of Qigong exercise 1. Lesson 26. Mechanism of Qigong exercise 2. Lesson 27. Mechanism of Qigong exercise 3. Lesson 28. Diagnosis/medical manual examination, the end of contents. Part-time musculoskeletal disease. Lesson 1. Low back pain and sciatica therapy procedure is as follows. 1. Examination. The leg 4 test. 1. Thomas, backside pain indicates BL40, BL62, BL36. Front side pain indicates key 6, SP12. 2. Hetric pain indicates SP12, SP6. 3. Bonnet, GB40, GB37, GB34, GB31, GB30, GB29. 4. SLR, BL40, BL36. 2. Planning and treatment. 1. Supine position. A pressure BL40 with traction femur. If SLR positive, pressure BL40 for 20 seconds, 3 times, with traction femur. B. Pressure SP12. If SP12 has tenderness, pressure SP12 with opposite hip flexed position, for 20 seconds, 3 times. 2. Side position pressure GB meridian. If the bonnet is positive, pressure along GB meridian, such as GB40, 37, 34, 31, 30, and 29. You can choose best viewpoints by search antenna. 3. Prone position. A piriformis technique. If the client has frog position in his/her leg, piriformis techniques are effective. Pressure piriformis, and same time, hip medial rotation with knee flex 90 degree. B. Pressure KI meridian. If the inside hamstrings are tight, pressure BL36, with stretching KI meridian, Achilles tendon. 4. In every position use PNF. 1. Hold relax. If the client is recognized as a sportsman, or having more than middle level of physical strength, PNF, hold relax, is effectively done. Remarks. 1. Focusing the gravity point, good posture, and relaxation. These 3 points are basic and important for us, not only the therapist, but also as the client. In practicing these 3 points, the therapist can strengthen the healing power, and the client can strengthen the natural healing power. 2. Preparation. Before the symptomatic approach mentioned above, the therapy should be started with general relaxation massage, because it is better and a safer way to begin. Lesson 2. Knee pain 1. Examination. In sitting position, static palpation first, and then kinetic movement tests later. The procedure is as follows. 1. Static palpation. A checking sign of inflammation, or not, swelling, heat, turn red, painful, malfunction. B. Checking of tightness and alignment. 2. Kinetic movement test. A flexion/extension. B. Medial/lateral rotation. C. Hip flexion. D. Ankle joint movement. Remarks. The aim of this test is to specify the painful movement and the painful points. 3. Search antenna. After specifying the discomfort core points, you can find effective distal points according to nerve supply, antagonistic muscles, and kinematic chain. 2. Planning and treatment. 1. In case of inside knee pain, this is the most common complaint as OA, and the local region is sensitive. The effective distal points are SP6, SP12, and the back shoe point between L2 and S3. 2. In case of outside knee pain, outside of patellotendon, the effective distal points are SE39, SE31, and back shoe points as same as above. Remarks. 1. Attention to kinesiology, nerve supply, antagonistic muscle, and kinematic chain is also should be considered. 2. Stress of opposite side of leg for the compensation, because having painful knee, physical body balance is damaged, and imbalanced body balance makes another problem. 3. Exercise and self-care for strengthen the knee. The following steps are appropriate. A. Swinging legs for relaxation for contraction, shrinkage joint capsule. B. Stretching and muscle strengthening, the tree pose of yoga. C. Wearing knee tight supporter while exercise. D. Keep warm, wearing soft loose supporter at any time. Lesson 3. Ankle pain 1. Examination in sitting position, static palpation first, and then kinetic movement tests later. The procedure is as follows. 1. Static palpation. A. Checking sign of inflammation, or not, swelling, heat, turn red, painful, malfunction. B. Checking of tightness and alignment. 2. Kinetic movement test. A. Checking circumduction movement, or dorsi/plantar flexion, inversion/eversion, and adduction/abduction. B. Knee and hip joint movement. 3. Search antenna. After specifying the discomfort core points, you can find effective distal points according to nerve supply, antagonistic muscles, and kinematic chain. 2. Planning and treatment. 1. In case of sprain of anterior talofibular ligament, it is the most common as a sprained ankle, and painful point is between anterior and lateral side. When local region having inflammation, distal points should be used. They are SE36 to 39, SE31, GB34, 37, and back shoe point L4-S3. 2. Exercise and self-care for strengthening the ankle. After acute stage, following exercise should be done. A. Swinging legs for relaxation for contraction, shrinkage joint capsule. B. Stretching and muscle strengthening. A little step-by-step way, stretching and muscle strengthen exercise should be done. Warming up carefully, and avoid pain. C. Wearing ankle-tight supporter while exercise. D. Keep warm, wearing soft loose supporter at any time. Lesson 4. Shoulder joint pain 1. Examination in sitting position, static palpation first, and then kinetic movement tests later. The procedure is as follows. 1. Static palpation. A. Checking sign of inflammation, or not, swelling, heat, turn red, painful, malfunction. B. In case of static pain, specifying painful points carefully. You have to touch the region with warm and relaxing hands. C. Checking of tightness and alignment, specifying specific sign of the symptoms according to flexibility and 3D way. 2. Kinetic movement test, neck shoulder 3 test. A. The neck circumduction. In case of movement pain, specifying exact discomfort points and specifying direction of the movement. You can find specific signs in the cervical vertebrae and nearby soft tissues. B. Shoulder circumduction. In same way, you can find specific signs of symptoms in the shoulder girdle and nearby soft tissues. C. Body rotation. In same way, you can find specific signs of symptoms in the shoulder and thoracic region. 3. Search antenna for distal points. After specifying the discomfort points by mentioned above, you can also find effective distal points according to the meridian theory or kinematic chain. 4. Search antenna for proximal points. In same way, you can also find effective proximal points according to the nerve supply, which is C5 and T1 level. You can find hard tissues nearby the spine. 2. Planning and treatment. This is divided into 3 groups according to discomfort region of shoulder joint as follows. 1. Anterior region, Li and ST. Distal points are Li 11 to 10, Sang 38. 2. Shoulder top and lateral region, TE and GB. Distal points are Te 9 to 8, GB 37. 3. Posterior region, Shi and BL. Distal points are Shi 7, BL 57 to 8. 4. Regarding the nerve supply to shoulder joint and nearby tissues comes from C5-T1. Then, you can find specific hard tissue or tenderness. Remarks. 1. Traction for joint contracture. Painful joint causes contraction of the joint and shrinkage of joint capsule and nearby muscles. Then, it causes a vicious circle of pain. After practicing some relaxation techniques, the neck traction and the shoulder traction are effective. 2. Needs of wide range of consideration. The shoulder joint is the most flexible and sensitive joint of the human body. You have to consider that the shoulder joint moves together with other joints, such as acromioclavicular, sternoclavicular, and scapulothoracic joint. These joints have kinematic chain with the vertebrae. Therefore, you have to approach the therapy in holistic approach. 3. Exercise and self-care. A. Swinging arms and twisting knees for relaxation. These are the first and second steps of Qigong exercise, which will be taught by Sasada later. Lesson 5. Neck shoulder arm syndrome 1. Introduction among our clients. This is one of the major symptoms along with low back pain and sciatica. Many clients complain their neck and shoulders are stiff and have discomfort related to using the computer for long hours. This problem is addressed in this category. 2. Examination. The procedure is almost same as 037 shoulder joint pain, and only change part is 4, as follows. 4. Search antenna for proximal points is divided into two types. A. C5 and T1, for problem of the shoulder and arm. B. C1 to 4, for headache, fatigue, eye, vertigo, ear, and nose problems. 3. Planning and treatment. 1. The comfort region first, discomfort region later. You should follow this rule. After the movement test and checking for tenderness, you can proceed as follows. A. If the neck circumduction is comfortable, start massage on the neck and move down to shoulder and arms. B. If the neck circumduction feels discomfort, then start from arm, shoulder, and neck. Remarks. According to the cause, chronic neck, shoulder, and arm syndrome is divided into 3 groups, and the massage therapy differs for each as follows. 1. Cervical spondylosis, the peripheral nerve root, mainly C5-T1, squeezed by degeneration of the spine. Relaxation of hard tissue, and the neck traction is effective. 2. Thoracic outlet syndrome, brachial plexus and subclavian artery are squeezed by at the thoracic outlet and induces painful/numbness shoulder and arm with poor blood circulation in the arm. Relaxation on scalenus anterior, medius, subclavius, and pectoralis minor are effective according to their hard tissue. The long, 20-second pressure on subclavian and axillary arteries is effective. 3. Spinal cord injury, cause of traumatic injury or severe cervical spondylitis may cause spinal cord damage, inducing pain, numbness, and paralysis called spasticity. Manual therapy should be done under the medical care or should be done carefully only distal regions. Lesson 6. Elbow pain 1. Introduction. In the lateral side of elbow pain is the most common and called as tennis elbow or lateral epicondylitis. The medial side elbow pain is called as golfer's elbow or medial epicondylitis. In this lesson, these 2 syndromes are introduced. 2. Examination. 1. Static palpation, a checking sign of inflammation or not, swelling, heat, turn red, painful, malfunction. B. In case of static pain, specifying painful points carefully. You have to touch the region with warm and relaxing hands. C. Checking of tightness and alignment, comparing with opposite side of the elbow. 2. Kinetic movement test, physical test. A. The painful grip test, whether pain occur or not. B. Resisted wrist extension, pain in tennis elbow. C. Resistant wrist flexion and pronation, pain in golfer's elbow. 3. Search antenna for distal points. After identifying the discomfort points using above methods, you can also find affected distal points in the wrist according to the meridian theory or kinematic chain. 4. Search antenna for proximal points. In same way, you can also find effective proximal points according to the nerve supply, which is C5 to 7 for tennis elbow and C7-T1 for golfer's elbow. 2. Planning and treatment. This is divided into two groups according to painful region of elbow. 1. Tennis elbow. Li, distal points are Li4, 8, 10, 11, and T8. 2. Golfer's elbow, HT, distal points are HD3, hard tissue on flexor carpi ulnaris, and She7. 3. Regarding the nerve supply, mentioned above. Remarks 1. Traction of the neck. Painful elbow tends to manifest joint contraction, and traction of the neck may relax the shrinkage. 2. Background. The painful elbow is linked to racket sports. These conditions can also be caused by other activities such as swimming and climbing. It also manifests in manual workers and waiters, those who play guitar and similar instruments, as well as by activities of daily living. These include signs of weakness of the forearm, sometimes found in a painful grip while shaking hands, or while turning a doorknob, or not being able to hold relatively heavy items in the hand. 3. Pathophysiology of lateral epicondylitis, inflammatory or chronic degenerative changes of the origin of the extensor carpi radialis brevis. Lesson 7. The wrist and finger pain. 1. Introduction. In this lesson, there are three major problems in the wrist and fingers: carpal tunnel syndrome, trigger finger, and Dacquer vein syndrome, which are common in our therapy, and the outlines are as follows. 1. Carpal tunnel syndrome. People with CTS experience intermittent numbness, tingling, or burning sensations in the palm, including thumb and fingers, in particular the index, middle fingers, and radial half of the ring fingers. The numbness often occurs at night. CTS are also associated with repetitive activities of the hand and wrist. 2. Trigger finger. The tendon becomes momentarily stuck at the mouth of the tendon sheath tunnel when you try to straighten your finger. You might feel a pop as the tendon slips through the tight area, and your finger will suddenly shoot straight out. Trigger fingers are more common in women than men, the ages between 40 and 60, and common in people with diabetes and rheumatoid arthritis. 3. Dacquer vein syndrome. It is a tenosynovitis of the sheath or tunnel that surrounds two tendons that control a movement of the thumb. The two tendons concerned are the tendons of the extensor pollicis brevis and abductor pollicis longus muscles. These two muscles, which run side by side, have almost the same function. Dacquer vein is more common in women, and the symptoms are pain, tenderness, and swelling over the thumb side of the wrist, and difficulty gripping. 2. Examination. 1. Static palpation. A checking sign of inflammation, or not, swelling, heat, turn red, painful, malfunction. B. In case of static pain, specifying painful points needs to be done carefully. You have to touch the region with warm and relaxing hands. C. Checking for tightness and alignment. Compare with opposite side of the wrist and fingers. 2. Physical test. Each syndrome has a specific physical test. A. Carpal tunnel syndrome. Tinal sign, finger tapping at the carpal tunnel, flexor retinaculum, PC7, and tenderness or numbness feeling showing as positive sign. B. Trigger finger. Just palpation, finding tender lump in the palm, swelling, catching, or popping sensation in the finger or thumb joint pain when bending or straightening the finger. 4. Dacquer vein syndrome. Finkelstein's test. The physician grasps the thumb, and the hand is ulnar deviated sharply. 3. Search antenna for adjacent points. After specifying the discomfort points by mentioned above, you can also find affected neighboring points in the forearm according to the meridian theory, or kinematic chain. 4. Search antenna for proximal points. In same way, you can also find effective proximal points according to the nerve supply, which is C7 to 8 for Dacquer vein syndrome, and C6-T1 for carpal tunnel syndrome and trigger finger. 2. Planning and treatment. According to the above finding, you can treat the therapy combined mainly forearm and the neck hard tissues. Remarks 1. Traction of the neck. It is effective method as same as elbow pain. 2. Background. The wrist and finger pain has genetic factor, as middle-aged women and people with diabetes with repetitive movements of the hand. You have to pay attention on holistic approach. Lesson 8. Spinal alignment/disalignment. 1. Healthy alignment. Observation of front/back direction. Healthy spine makes a straight line, and observation of the side makes double S shape. In standing posture, following 5 points should be located in a vertical same line: ear, acromion, hip joint, center of the knee, center of the foot. 2. Unhealthy alignment, disalignment. Kyphosis, lordosis, and scoliosis. 3. Causes of the disalignment. These disalignments are caused by both of traumatic injury and aging degeneration. Specific causes are A. Overuse, repetitive use, overload to the spine. B. Wrong posture, unhealthy lifestyle, e.g., long hours use PC, smartphone, sitting and crossing legs, wearing high heels, etc. C. Aging degeneration of the spine, e.g., wearing of the cartilage and discs, bone spurs, and osteoporosis. 4. How to avoid disalignment and how to keep healthy spine. Practicing regular exercise which is gentle and rhythmic. The joint cartilage needs metabolism by appropriate movement exercise. Remarks: osteoporosis, kyphosis after menopause. Age is often caused by compression fracture of vertebral body. Lesson 9. Spinal alignment/disalignment. 2. Structural problem versus functional problem. Structural disalignment is not cured by jmmt, but please focus on the following therapy procedure. You will understand the substantial advantage. 1. Cause of disalignment. The spinal disalignment is often caused by long years imbalance usage of the client's body and his/her motor function, e.g., repetitive/overuse of muscles, and various traumatic triggered injury background. 2. Contracture/shrinkage. When we observe/examine the spinal disalignment, the substantial contracture and shrinkage is usually found at the local region, nearby region, and even distal regions. These hard tissues are tense muscles, fascia, and ligaments. 3. Vicious circle. The spinal disalignment is worsened by the contracture and shrinkage, and this mechanism makes vicious circle in the client body. This procedure takes long years with his/her lifestyle, aging degeneration, and stress from gravity of the earth. 4. Approaching the function and obtain the natural healing power. This is the important focusing point for the therapy. Please find the functional imbalance and then make balance. Please remove the contracture/shrinkage with softening the tissues by jmmt. After the therapy and after relief from the vicious circle, the client feels refreshing and allergy. Obtaining balanced body function. The client's having hidden natural healing power is activated. This is the jmmt concept. Lesson 10. LPP and CPP of the joint. 1. Osteokinematics versus arthrokinematics. The osteokinematics is classic approach to the joint movement. On the other hand, focusing the joint surface and its accessory movement, it is called arthrokinematics, or joint mobilization. Nowadays, it is effectively used for various kind of contracture, shrinkage, and joint pain. 2. LPP and CPP. LPP, least packed position, the most relaxing position of the joint and appropriate to apply traction technique for the shrinkage. Example, in spine position, during applying pressure BL40 and traction femur, the hip joint is LPP. CPP, close packed position, the most tight position of the joint and appropriate to apply distal vibration techniques. For example, during chakra vibration, ankle, knee, and hip joints are CPP, and vibration energy effectively reach from the foot sole to the abdomen. 3. Table spine, intervertebral joint, LPP, mid position. CPP, extension. Shoulder joint. LPP, mid position in abduction, flexion, and rotation. CPP, abduction and lateral rotation. Humeroulnar joint. LPP, mid-flexion. CPP, extension. Wrist joint. LPP, mid-flexion. CPP, extension. Hip joint. LPP, flexion 30, abduction 30, slightly lateral rotation. CPP, extension, medial rotation. Knee joint. LPP, flexion 25. CPP, extension. Ankle joint. LPP, plantar flex 10. CPP, dorsiflex. Question. In supine position, the binding legs technique, what is the role of binding? Lesson 11. Osteoarthritis, OA, degenerative joint disease, DJD. 1. In case of USA, about 14% of the population, and close to 34% of the aging population, the incidence of lumbar disc degeneration is often reported to exceed 50% in the aging population, and even exceeds 20% in the young population. 2. Major suffering joint, spine, hip, knee, ankle, and wrist. 3. Major symptoms, pain, lack of flexibility, disalignment, swelling, muscle stiffness and weakness. 4. Pathologies, degeneration of cartilage, wear and tear, synovial bursa, ligament, joint capsule, fibrous degeneration, and formation of osteophyte. 5. Questions on neck and hip joint. What are the different mechanisms of pains which are whether bending side or stretching side? 6. Cases of difficulties of jmmt knee pain, arthrophyte, floating cartilage, joint mouse. The cartilage becomes brittle and splits. Some pieces may break away and float around inside the synovial fluid within the joint. This can lead to inflammation. Eventually, the cartilage can break down so much that it no longer cushions the two bones. Current theory suggests that the cartilage loses its elasticity. Remarks osteophyte, bone spur. Rheumatoid arthritis, an immune-mediated condition that causes inflammation in synovial joints. Although people who develop rheumatoid arthritis may have a predisposition to the condition, the trigger for developing symptoms is unknown. Inflammation in joints results in an increase in synovial fluid, swelling of the joint, pain, and morning joint stiffness. Joints that can be affected include those of the hands and wrists, elbows, shoulders, neck, jaw, hips, knees, ankles, and feet. Part 2. Internal disease. Lesson 12. Autonomic nervous system and jmmt. 1. About autonomic nervous system. Sympathetic and parasympathetic divisions typically function in opposition to each other. The sympathetic division typically functions in actions requiring quick responses. The parasympathetic division functions with actions that do not require immediate reaction. The sympathetic system is often considered the fight or flight system, while the parasympathetic system is often considered the rest and digest, or feed and breed system. 2. X vagus nerve. The important parasympathetic nerve which covers thoracic and abdominal organs, but doesn't cover pelvic organs. 3. Sacral spinal nerve, S2 to 4. Parasympathetic nerve covers pelvis organs. 4. Penteric nervous system. The bowel movement is controlled by autonomic nervous system. It has not only conventional external system, but also internal nervous system which is recently found. The enteric nervous system independently controls bowel movement and hormone secretions. The coordinating role of the system may belong to, e.g., Meissner plexus and Auerbach plexus. Remarks the chakra vibration reach abdominal organs, then it may activate both internal enteric nervous system and external parasympathetic nervous system. Lesson 13. Nature, rhythm and autonomic nervous system. 1. Abdominal breathing. During exhaling, parasympathetic nerve is activated, and during inhaling, sympathetic nerve is activated. B. Breathing times per minutes for times. As a Buddhism monk and a yoga expert. C. Discomfort, like pain and mental stress, stimulates our sympathetic nerve and makes imbalance of ANS. Slow rhythmic abdominal breathing stimulates parasympathetic nerve and makes balance. 2. Heart rate tension stimulates sympathetic nerve and then makes rapid heart rate. Relax induces parasympathetic nerve and slow down the heart rate. 3. Circadian rhythm, day and night, 24 hours rhythm. B. Sympathetic nerve is stimulated during daytime, and parasympathetic nerve at night time. C. Circadian rhythm is stimulated and changed by light and temperature. D. Is secreted during daytime, and melatonin secretion at night time. E. Obesity and diabetes are associated with lifestyle, e.g., imbalance of circadian rhythm. 4. Monthly and yearly rhythm. Monthly rhythm has no scientific evidence, but yearly, seasonal rhythm has certain evidence. C5 element. Lesson 14. Headache and fatigue of the eye. 1. Introduction after finishing musculoskeletal problems. Document 034-040. The lesson is stepping into internal pathogenic problems, focusing on autonomic imbalance and hormone imbalance. This lesson is the first session of internal problems. The headache is classified as follows. 1. Primary headaches, the most common types, and divided into 2 symptoms. A tension type headache with stiff neck and stiff shoulder. More than 70% of headaches is primary, and manual therapy is appropriate. B. Migraine, pulsating pain, affecting one side of the head, associated with nausea, severe pain, lasts between 3 hours and 3 days. It is between 20 and 30% of the headache. 2. Secondary headaches caused by other diseases such as infectious diseases, brain tumor, stroke, etc. It is not so common, and it is less than a few percent, though. You have to be careful the original disease. Remarks. Thunderclap headache, no manual therapy, it needs emergency medical care. The symptoms are loss of consciousness, inability to flex the neck forward due to stiffness. Specific names are subarachnoid hemorrhage and meningitis, inflammation of the brain. 2. Examination. 1. Appropriate for manual therapy or not? Check the pain level. If the pain level is the first or worst in the client's history, then he/she should visit to medical doctors. 2. Classifying by meridians according to the painful region. The headache is classified into 4 groups, and showing each distal points as follows. A. Lateral of head, TE and GB, T3, 5, GB 12, 20, 40 to 41. B. Posterior of head, SHE, and BL, SHE 3, 4, BL 10 to 13, 62. C. Anterior of head, LE, and ST, LE 4, Saint 8, 43 to 44. D. Top of head, LV, and GV, GV 20, LV 2 to 3. 3. Search antenna for distal and adjacent points. According to the guidelines on classifying by meridian theory, you should check the best points by search antenna. 2. Planning and treatment according to checking above mentioned, classifying for types, and checking search antenna, you can treat as follows. 1. Procedure. Distal points at first, adjacent points at second, and the local points should be the last. 2. Therapy techniques. A tension type headache, suffering stiff neck and stiff shoulder muscles. The therapy is done by kneading and pressure. The finger rocking on the stiff region is also effective. The migraine type headache, client is sensitive, pressure at distal points, and focusing imbalance to make balance. Remarks. 1. Traction of the neck. It is effective method as long as the client feels relaxed. You must be careful. 2. Trigeminal neuralgia, postherpetic neuralgia, shooting facial pain, and sensitive pain. You have to find effective points at distal region and opposite side according to the meridian and compensation pain. Lesson 15. Digestive problems. 1. Introduction. Digestive symptoms are strongly related with an imbalanced autonomic nervous system, ANS, and are the appropriate focus point of manual therapy. The ANS is divided into 2 subsystems, the parasympathetic nervous system, PSNS, and sympathetic nervous system, SNS, which operate independently in some functions and interact cooperatively in others. In many cases the 2 have opposite actions, where one activates a physiological response and the other inhibits it. During an active daytime, sympathetic nerve is dominating, and while relaxing/sleeping at night, parasympathetic nerve is dominating. The sympathetic nervous system is a quick response mobilizing system, and the parasympathetic is a more slowly activated dampening system. Nowadays, we are living in the IT revolution, and many of our clients are suffering from mental stress regarding quick change in the environment. Many of us cannot smoothly adjust pace of life. Usually mental stress causes excess of SNS, and some minor case, like the depression, causes excess PSN. 2. Physiological differentiation of SNS and PNS. 1. Skeletal muscles. SNS, having blood more and ready to move. PNS, no reaction. 2. Smooth muscle, bowel movement. SNS, less movement. PNS, active movement. 3. Secretion of digestive glands. 4. The side, BL 18-19, GB, and LV, GB 29-41, V and SNS, less active. PNS, active to secrete. 3. Differentiation by the meridians according to positive signs of palpation, PSP. The digestive symptoms are divided into 3 groups as follows. Written orders are abdomen back shu points and related distal points. 1. Between CV 8 to 12, BL 20 to 21, ST, and SP, Saint 36 to 40, SP 4, 6, BL 17, 20 to 21, PC 6. 2. Between CV 14 to 17, BL 14 to 15, PC, and SP, PC 4 to 8, SP 4, 6, Saint 36. 3. Between CV 4 to 6, BL 23 to 28, KI, and SP, Key 6, SP 6, 12, Saint 36. Remarks. Search antenna for distal and adjacent points. According to the guidelines on classifying by meridian theory, you should check the best points by search antenna. 4. Therapy treatment. According to following signs, you can choose appropriate techniques. Having weak or strong body. Balance between yin-yang. Focus on holistic approach. Lesson 16. Woman's symptoms. 1. Introduction. There are a lot of complaints of women which are recognized with autonomic and hormone imbalance, such as headache/migraine, nausea, stiff neck, shoulder, palpitation, bloating chest and abdomen, painful abdomen and lumbar, cold feet, discomfort, irritating, other imbalance in autonomic and hormone. In this physiological balance/imbalance, the woman's body is more complicated and sensitive than the man's body because of having particular function of menstruation and its related physiological problems. The nerve centers of autonomic nervous system and hormone secretion are linked together at hypothalamus, see reference 5. Therefore, either problem affects another one, then the result makes more complicated syndromes. This lesson is focusing woman's symptoms, checking physiological imbalance, and making balance by jmmt, Japanese Medical Manual Therapy. 2. Palpation. Checking balance/imbalance of skin temperature and tenderness by palpation, as follows. 1. Between right and left of upper/lower limbs. 2. Between upper/lower bodies. 3. Between 5 fingers/toes. 4. Between upper/lower umbilicus and right/left umbilicus. 5. Between 12 back shu points. 3. Therapy treatment. After finding imbalance, making balance as follows. Some clients might be suffering from osteoporosis. You have to be careful. See references. 1. Giving reinforcing, warming techniques to the energy deficiency points/meridians. 2. Giving cooling down, refreshing techniques to energy excess points/meridians. Remarks. 1. Sign of deficiency versus excess as follows. A. Edema versus hard tissue. B. Depression versus swelling. C. Cold versus warm. D. Poor versus excess blood circulation. 2. Techniques for reinforcing versus cooling down are as follows. A. Warming mind versus cooling down mind. B. Calm versus quick. C. Pressure versus kneading. 4. References. 1. Osteoporosis. Most common problem in women after menopause. Typical fractures occur in the vertebral column, rib, hip, and wrist. Some other clients might be suffering from steroid-induced osteoporosis, SIOP. You have to give them gentle, soft techniques only. 2. Menopause. Major symptoms are irregular menses, hot flashes, and night sweats, increased stress, breast tenderness, forgetfulness, mood changes, and osteoporosis. 3. Dysmenorrhea. Menstrual pain. It may precede menstruation by several days during menstruation, menstrual cramps, menstrual uterine contractions. 4. PMS. Premenstrual syndrome. Discomfort starts about 10 days before and finishes at starting the menstruation period. The discomfort, such as bloating breast and abdomen, lumbar pain, migraine, irritation, etc. 5. Hypothalamus. The major functions are to link the nervous system to the endocrine system via the pituitary gland. The hypothalamus is located below the thalamus, just above the brainstem, and the size of an almond. It is responsible for certain metabolic processes and other activities of the autonomic nervous system. It synthesizes and secretes certain neurohormones, often called hypothalamic-releasing hormones, and these in turn stimulate or inhibit the secretion of pituitary hormones. The hypothalamus controls body temperature, hunger, and important aspects of parenting and attachment behaviors, thirst, fatigue, sleep, and circadian cycles. Lesson 17. Lifestyle Diseases 1. Introduction. As India becomes more industrialized, and many people have to change their pace of life, and it is not easy to keep mind-body unity. Even though they live longer, many are suffering from lifestyle diseases which include diabetes, atherosclerosis, heart disease, asthma, chronic renal failure, osteoporosis, stroke, depression, and obesity. jmmt can help them refresh back to pace of life and feel mind-body unity by talking hands. 2. Therapy examination and treatment. 1. To differentiate the client body as type yin, weak, or yang, strong. 2. In case of type yin, therapy starts in supine or side position. Specific procedure is same as Doc 043. 3. In case of type yang, therapy starts in prone position. The specific procedure is as same as Doc 034-40. 3. Remarks. Additional comments. 1. Advantage. As the Vegetarian Dietitian Association of North America reported in 2003, that pure vegetarians have less risk of lifestyle diseases and dementia. 2. Advantage of regular exercise. A static exercise as yoga, qigong for mind-body unity. B. Kinetic exercise for body flexibility and strengthening. See Doc 045. 3. Functional versus structural diseases. All the diseases are divided into two categories, functional and structural. Manual therapies only can help/improve functional problems. Regardless, every structural disease has certain level of functional symptoms. Because our clients are human, mind-body unity has great value. Lesson 18. Obesity. 1. Question 1. How do you answer about the question from your clients that they say, can jmmt reduce my body weight? 2. Overweight and obesity. A BMI, body mass index. A BMI between 25 to 29.9 is considered overweight, while a BMI of over 30 is an indication of obesity. 3. How to calculate BMI index. BMI equals weight, kg/height, cm/height, cm. 4. Remarks. According to the statistic, 68% of American population are either overweight or obese. 5. Question 2. Which timing of exercises are more effective for diet, before meal or after meal? Key points are: A. Before meal is better. B. Low blood sugar level makes us hungry feeling. C. When blood sugar level down, liver releases sugar into the blood. This means that exercise can reduce hungry feeling, and this is a big benefit for the weight down. D. Blood sugar level of healthy body is controlled as a constant level by hormones, e.g., insulin, glucagon, etc. E. After meal, blood sugar level is high, then liver doesn't releases insulin. For your weight down, releasing sugar from liver is needed. F. Procedure of slim down your body liver, go to visceral fat, go to subcutaneous fat. G. Exercise makes reducing organ fat, and decreasing cholesterol too. H. Continuing regular exercise is key point, so the timing and methods are important. I. Exercise makes our body temperature up, and when our brain feel temperature up, then hungry feeling reducing. This is the reason of reducing appetite in hot summer days. 6. Differences. Lifestyle between slim body and overweight persons. A. Preference walking and use staircases, or not walking and use lifts. Be actively moving around inside the house, or less active and long hours sitting at PC/TV. 7. What is healthy diet? A. Please eat much green and yellow vegetables and mushrooms. B. Eat vegetables and soup at first, eat carbohydrate later. In this way, absorption of sugar is getting slow and feeling of fullness can maintain long hours. C. Eat after feeling hungry, and don't eat much. D. Eat slowly, and chewing 30 times per portion. Slow eating makes secretion of insulin slow down, and chewing 30 times makes full stomach feeling in our brain. 8. How to reduce weight with knee pain. A. Set to step on the floor. The height is 10 to 20 centimeters. B. Set 2 chairs with the chair back facing inside. 4. Do step up and down with holding chair backs. D. 10 minutes and 3 times every day is appropriate. Lesson 19. Hypertension, high blood pressure. 1. What is hypertension? Hypertension is high blood pressure. Blood pressure is a measure of the force of blood against the walls of the arteries. In some people, the blood cannot flow easily through these arteries. For example, if the arteries are narrowed for some reason, the pressure will go up to keep the blood flowing. This is high blood pressure. Remark systolic blood pressure, between 120 to 140, and diastolic blood pressure, 80 to 90, is called prehypertension. 2. How many hypertension people are in India? It is estimated that 30% population in urban areas and 15% in rural areas have hypertension. Who estimated in 2008 33% men and 32% women older than 25 years had hypertension in India? 3. What are the symptoms of hypertension? The answer is any symptoms at all. Hypertension is called the silent killer because most people who have it do not feel sick, but if left uncontrolled, it can lead to a heart attack or kidney disease. This is why it is so important to treat hypertension even if you feel fine. Many people can keep their hypertension under control by making some changes in their daily activities, such as increasing exercise and eating a healthier diet. Other people may need to take medicine in addition to diet and/or exercise. 4. How does one cope with hypertension? The most important treatments are combination of diet, exercise, and medication. A. Lose weight. If you weigh too much, your heart may have to work harder to pump blood. Find out what your ideal weight range should be. This is important to know because as you gain weight, your blood pressure sometimes increases. Losing extra weight is often the best way to lower blood pressure. B. Medical care. Most people with high blood pressure need to take medicine. If your doctor sees that diet and exercise are not enough to control your blood pressure, medication may be prescribed to you. Take your medication as directed to, and not stop taking your medication unless your doctor tells you to stop. C. Diet. Limit the amount of salt. Do not add salt to your food. Avoid foods high in salt. Avoid eating foods high in fat like deep-fried food. Avoid cooking with excess butter. D. Smoking/alcohol. Cigarette smoking is damaging to the heart and blood vessels. If you stop smoking, this will help to lower your risk of a heart attack or stroke. Alcohol can also raise your blood pressure. It is best to avoid or limit drinking and doing exercise. Exercise. If you exercise on a regular basis, e.g., walking and other aerobic type exercise, more than 30 minutes every day is appropriate, and even 15 minutes every day having benefit as well. F. Family support. Let your family know that you have high blood pressure. This is important because high blood pressure tends to run in the family. It is a good idea for other members of your family, age 20 and older, to get their blood pressure checked as well. They can help you follow your doctor's advice. They can remind you to take your medication. Everyone can benefit from a low-fat, low-salt diet. Lesson 20. Diabetes mellitus. 1. Introduction. Diabetes. Person has high blood sugar, either because the pancreas does not produce enough insulin or because cells do not respond to the insulin. There are 3 categories: type 1, type 2 diabetes, and others. A. Type 1 diabetes. Loss of the insulin-producing beta cells of the islets of Langerhans in the pancreas, leading to insulin deficiency. This type can be further classified as immune-mediated or idiopathic. The majority of type 1 diabetes is of the immune-mediated nature. There is no known preventive measure against type 1, which causes less than 10% of all diabetes cases. B. Type 2 diabetes. Insulin resistance, which may be combined with relatively reduced insulin secretion. This is the most common type. The classic symptoms of untreated diabetes are loss of weight, frequent urination, increased thirst, and increased hunger. See others: symptomatic pregnancy diabetes, steroid diabetes, etc. 2. Complications. All forms of diabetes increase the risk of long-term complications. These problems typically develop after many years, 10-20. A. Diabetes doubles the risk of cardiovascular disease. The main macrovascular diseases related to atherosclerosis of larger arteries are ischemic heart disease, angina, and myocardial infarction, stroke, and peripheral vascular disease. B. Diabetes also damages the capillaries, causes microangiopathy. Diabetic retinopathy, which affects blood vessel formation in the retina of the eye, can lead to visual symptoms including reduced vision and potentially blindness. Diabetic nephropathy, the impact of diabetes on the kidneys, can lead to scarring changes in the kidney tissue, loss of small or progressively larger amounts of protein in the urine, and eventually chronic kidney disease requiring dialysis. C. Another risk is diabetic neuropathy, the impact of diabetes on the nervous system. The most commonly causing numbness, tingling and pain in the feet, and also increasing the risk of skin damage due to altered sensation. Together with vascular disease in the legs, neuropathy contributes to the risk of diabetes-related foot problems, such as diabetic foot ulcers, that can be difficult to treat and occasionally require amputation. As well, proximal diabetic neuropathy causes painful muscle wasting and weakness. 3. Management. Type 2 diabetes is due primarily to lifestyle factors and genetics. Type 2 is usually first treated by increasing physical activity and eliminating saturated fat, and reducing sugar and carbohydrate intake, with a goal of losing weight. Remarks. 1. Approximately 95% of people with diabetes have type 2 disease, but most can control the disease through a combination of weight loss, exercise, and diet control. Most people diagnosed with type 2 are age 30 or older. Half of all new cases are below the age of 50 in India. Many people with type 2 diabetes have sedentary lifestyles and are obese. They weigh at least 20% more than the recommended weight for their height and build. Lack of exercise, especially in those who are overweight, increases risk. 2. Both of type 1 and type 2 disease runs in families. 3. If you developed pregnancy diabetes, you're at a higher risk of type 2 diabetes later. Lesson 21. Cardiovascular disease, CVD, coronary artery disease. 1. Introduction. A definition of CVD. This is a class of diseases that involve the heart or blood vessels, arteries, capillaries, and veins. It includes vascular diseases of the brain and kidney, and peripheral arterial disease. B. Epidemiology. This is the leading cause of deaths worldwide, though since the 1970s, cardiovascular mortality rates have declined in many high-income countries. At the same time, cardiovascular deaths and disease have increased at a fast rate in low- and middle-income countries. Although cardiovascular disease usually affects older adults, but it has preliminary long years history of atherosclerosis, begin in early life, making primary prevention efforts necessary from childhood, such as healthy eating, exercise, and avoidance of smoking. 2. Specific major diseases. A. Coronary heart disease, ischemic heart disease. This is the major cause of heart attacks. The coronary artery disease is rising steeply in India. It has risen from 1% in 1960 to 11% in 2003 and 14% in 2011 in India's around 1/4 of all deaths in India in 2008. CVDs are expected to be the fastest growing chronic illnesses between 2005 and 2015. A more worrying fact is that the incidences of CVDs have gone up significantly for people between the ages 25 and 69 to 24.8%, which means we are losing more productive people to these diseases. The disease is caused by plaque building up along the inner walls of the arteries of the heart, which narrows the arteries and restricts blood flow to the heart. It is the leading cause of death worldwide. If the ischemia attack of the heart muscle is temporal and reversible, then it is called angina pectoris, and more severe attack making irreversible damage of the muscle is called cardiac infarction. Remarks. 1. Cardiac dysrhythmia, abnormalities of heart rhythm. 2. Cerebrovascular disease, disease of blood vessels, that supplies to the brain such as stroke. 3. Peripheral arterial disease, disease of blood vessels, that supplies to the arms and legs. 4. Rheumatic heart disease, heart muscles, and valves damage due to rheumatic fever caused by streptococcal bacteria infections. 3. Risk factors of CVD: atherosclerosis, blood pressure, high serum cholesterol levels, tobacco smoking, excessive alcohol consumption, sugar consumption, family history, obesity, lack of physical activity, psychosocial factors, diabetes mellitus, air pollution. 4. Prevention: practicing healthy lifestyles such as heart-friendly nutrition, exercises, tobacco abstinence, weight management, hypertension, diabetes care, and stress management will enhance corporate health. Lesson 22. Respiratory disease. Respiratory diseases has wide range from mild and self-limiting, such as the common cold, to life-threatening entities, like bacterial pneumonia, pulmonary embolism, and lung cancer. 1. Upper respiratory tract infection. The most common upper respiratory tract infection is the common cold. However, infections of specific organs of the upper respiratory tract such as sinusitis, tonsillitis, otitis media, pharyngitis, and laryngitis. 2. Lower respiratory tract infection. The most common lower respiratory tract infection is pneumonia, an infection of the lungs which is usually caused by bacteria. Worldwide, tuberculosis is an important cause of pneumonia. Other pathogens such as viruses and fungi can cause pneumonia. 3. Malignant tumor, lung cancer. Malignant tumors of the respiratory system, particularly primary carcinomas of the lung, are a major health problem responsible for 15% of all cancer diagnoses and 29% of all cancer deaths. The majority of respiratory system cancers are attributable to smoking tobacco. 4. Asthma. Asthma is a difficulty in breathing causing wheezing due to inflammation of bronchi and bronchioles. This causes a restriction in the airflow into the alveoli. Asthma attacks can be brought on by triggers such as air pollution, tobacco smoke, factory fumes, cleaning solvents, infections, pollens, dust, foods, cold air, exercise, chemicals, and medications. Triggers are highly individual and may not be related to allergens. Remarks. 1. The nervous system in asthma. The sympathetic system is concerned with metabolic processes that use energy. The parasympathetic system is concerned primarily with metabolic processes that conserve energy. In the airways, stimulation of the parasympathetic system causes bronchial tubes to constrict, whereas stimulating the sympathetic nervous system produces the opposite reaction, dilation. In normal airways, a balance between these two systems maintains comfortable breathing. In asthmatic airways, there is sometimes an imbalance favoring the parasympathetic system that produces narrowing or constriction of the airways. 5. COPD, chronic obstructive pulmonary disease. Many patients with COPD may have underlying chronic asthma, and many are active or former smoker. Many may have associated emphysema in conjunction with intermittent symptoms of asthmatic bronchitis. Preventing a flare-up of COPD and/or underlying asthma may further help improve quality of life and may decrease use of acute care/hospitalization. There are no specific COPD cures, but controlling the symptoms helps improvement of respiratory symptoms and sense of well-being. Remarks. 2. Emphysema and chronic bronchitis. In recent few decades, these diseases were united into COPD. 3. Barrel chest. Damaged alveoli is enlarged and lack of elasticity and push out the thoracic cavity. 3. Management of COPD. Avoiding certain foods, usually cold water, cold drinks, dairy products, ice cream, and chocolate may trigger underlying COPD/asthma. Bananas increase mucus formation. B. Exercise. Regular exercise further helps to control asthma. If someone has exercise-induced asthma, may use a rescue inhaler prior to that. See pranayama/yoga. Many breathing exercises such as slow deep breathing, alternated nostril breathing, if done correctly over a period or time may further decrease bronchospasm. If one is interested, he/she may learn many of the simple yoga exercises, and by doing it may further help control asthma symptoms, along with good sleep, regular exercise, avoiding the triggers of asthma. Part 3. Mechanism and Analysis of jmmt. Lesson 23. Anatomy related with facial massage. 1. Facial muscles. Nerve supply. Facial muscles. 7 facial nerve, including parasympathetic nerve which are tear gland and salivary glands. Therefore, facial massage may associate with activation of parasympathetic nerve. B. Mastication muscles. V. Trigeminal nerve. The finger rocking method may activate salivary glands and its parasympathetic nerve. 9. Glossopharyngeal nerve. 2. Neck muscles and nerve supply. A. Muscles along superior nuchal line on mean, sternomastoid, longissimo, splenius. GB12, splenius, longissimo, semispinalis, capitis. GB20, trapezius, semispinalis, splenius. B. Nerve supply. The nerve supply of muscles above mentioned is cervical nerve, then checking disalignment, shrinkage, and relax, with neck traction as appropriate. Remarks. Relief from mental stress. The activation of parasympathetic nerve may induce the stress relief. The parasympathetic nerves 7, 9, and X are running near the mastoid process, then gentle, rhythmic, and deep techniques may induce activation of parasympathetic nerve. Lesson 24. Mechanism of facial release. 1. The fascia from physio textbook. Groups of muscles are contained in compartments separated from other groups in other compartments by tough fibrous sheets known as intermuscular septa. These septa are usually attached to bone and to the investing deep fascia that surrounds all the muscles, like a bandage. 2. The fascia from Wikipedia. A layer of fibrous tissue. A fascia is a structure of connective tissue that surrounds muscles, groups of muscles, blood vessels, and nerves, binding some structures together, while permitting others to slide smoothly over each other. They are classified according to their distinct layers: superficial fascia and deep fascia. A. Superficial fascia. This is found in the subcutis in most regions of the body, blending with the reticular layer of the dermis. B. Deep fascia. This is the dense fibrous connective tissue that interpenetrates and surrounds the muscles, bones, nerves, and blood vessels of the body. 3. Myofascial release. A form of soft tissue therapy used to treat somatic dysfunction and resulting pain and restriction of motion. A. The direct myofascial release, or deep tissue work, method engages the myofascial tissue restrictive barrier tension. The tissue is loaded with a constant force until release occurs. Practitioners use knuckles, elbows, or other tools to slowly stretch the restricted fascia by applying a few kilograms for tens of newtons. Direct myofascial release is an attempt to bring about changes in the myofascial structures by stretching or elongation of fascia or mobilizing adhesive tissues. The practitioner moves slowly through the layers of the fascia until the deep tissues are reached. The indirect myofascial release. The indirect method involves a gentle stretch with only a few grams of pressure, which allows the fascia to unwind itself. The dysfunctional tissues are guided along the path of least resistance until free movement is achieved. 1. Lesson 25. Mechanism of Qigong exercise. 1. Swinging arms. 1. Healthy persons have enough flexibility in their bodies, but unhealthy persons having less flexibility, which means having shrinkage/contracture in their joints and muscles. 2. Qigong exercise guides their body flexible in their joints and muscles. The key points are: A. Good chakra breathing. B. Good posture. C. Relax core muscles with slow and rhythmic movement. 3. Rhythmic centrifugal force in the arm. A. Joints of the arm are pulled with centrifugal force, and joint capsules are stretched, and the inside pressure is getting decrease. B. Rhythmic swinging arms makes the pressure minus plus alternately while repeating it. It makes improve the joint inside metabolism. 4. Stretching muscles of swinging arms. 4 to 1. When arms swing to the front, A. Abduction of the scapula, trapezius, middle fiber, rhomboids. B. Flexion of the arm, latissimus dorsi, deltoid, posterior fiber, teres major, triceps, long head. C. Supination of the arm, subscapularis. 4 to 2. When arms swing to back, the adduction of the scapula, anterior serratus, pectoralis major and minor. E. Extension of the arm, deltoid, anterior fiber, colbractidal, biceps, long head. F. Pronation of the arm, infraspinatus, teres minor. Lesson 26. Mechanism of Qigong exercise. 2. Twisting knees. 1. Focusing lateral and oblique muscle fibers. Many rotator muscles of our body are stretched and relaxed by the twisting knees. They are, e.g., hip rotators, abdominal obliques, sternomastoid, etc. 2. Paraspinal muscles. The spine is supported by paraspinal muscles. The vertical and spiral muscles support our body and giving flexibility as follows. Vertical muscles, erector spinae, spiral muscles, semi-spinalis, multifidus, and rotator. 3. Rhythmic stretch, relax, alternate movement. Long hours sitting for office work often makes discomfort feeling with stiff and painful muscles. The twisting knees guides and brings back us relax and flexible body. Remarks: analytic versus holistic approach. The modern medical science indicates that rhythmic gentle exercise activating parasympathetic nervous system, and traditional complementary medicine, the rhythmic relaxing movement improves chi energy circulation in our body. Lesson 27. Mechanism of Qigong exercise 3. Hula hoop and swinging legs. 1. Basic kinesiology: agonist, antagonist, synergist, and fixator. These 4 types of muscle actions are relative relationship each other like action/reaction. Please specify your understanding on specific major muscles in each joint axil movement. 2. Stretching muscles of hip joint movement. Joint type of hip joint is ball and socket, 3 axial joint, and having following 6 directions as its groupings. A. Flexion gluteus maximus, hamstrings, adductor magnus. B. Extension iliopsoas, rectus femoris, TFL. C. Adduction gluteus medius and minimus, TFL, gluteus maximus, rectus femoris. D. Abduction adductor magnus, adductor longus, and minimus. E. Medial rotation piriformis, and 4 other hip rotators. F. Lateral rotation gluteus medius and minimus, TFL. 3. Nerve supply. The spinal level of nerve supply indicates effective pressure/therapy points, and then it is important knowledge. L2 to 4, hip flexor and adductor muscles. L4-S3, hip extensor and abductor muscles. Lesson 28. Diagnosis/medical manual examination. For your easy to understand, let us simplify the unhealthy conditions. Every symptoms are divided into 2 categories, yang and yin, which are musculoskeletal problems, and internal, autonomic nervous/hormone system balance problems. 1. Checking structural balance/imbalance. If a client has musculoskeletal problem and has not internal problem, type yang, then the following procedure is appropriate. 1.13 Body lines, ASIS, acromion, and mastoid process. 1.2 Alignment/disalignment of the spine, static and kinetic ways of approach. 1.3 Movement test, the shoulder 3 test, the leg 4 test. Remarks: analytic and holistic approach. You have to pay attention in both ways. For instance, the physical test is a typical analytic way, and yin-yang differentiation is a holistic way. 2. Checking functional/internal balance. If a client has any complaints about sleep, appetite, or bowel movement, following procedure is appropriate. 2.1 Check radial artery pulse, posture, breathing, mind position, how to touch, and piling up the experiences. 2.2 Abdominal palpation. Cold skin/tenderness shows the deficiency of energy, as follows. ACV 4 to 6 indicates Ki/Bl deficiency. BCV 10 to 12 indicates SP/STC. CV 14 indicates HT/PCD. The side of abdomen indicates LV/GBE. LU 1 to 2 indicates LU/Li. 2.3 Back shoe points between C7-S2. There are following signs. AC7, GV14, indicates all arm yang meridians, Li, Te, Shi. BBL 13, Lu. CBL 14 to 15, HT/PC. DBL 17, Lu/SP. EBL 18 to 19, LV/GB. FBL 20 to 21, SP/SD. GBL 23 to 28, Ki/BL in male, and SP/Ki in female. 2.4 Palpation of the limbs. Fingers and toes indicate as follows: A. Thumb, Lu. B. Index finger, Li. C. Middle finger, PC. D. Ring finger, Te. E. Small finger, HT/She. F. Big toe, LV/SP. G2/3 toe, SD. H. Fourth toe, GB. I. Fifth toe, BL. J. Weak/cold foot, KI. Remarks: search antenna. It is always effective to find distal effective points. Excellent sensitivity of the antenna will be performed by good posture, breathing, and relaxing core muscles.